Good evening and welcome to The Square. Tonight is going to be an important discussion. We're going to look at the impact of the COVID-19 pandemic, the impact of it on teenage pregnancies in Rwanda. Now, we've had this discussion on the show several times regarding unwanted teenage pregnancies, but tonight we wanted to put it in context and look at how the pandemic has had an effect. This pandemic globally is a crisis, has had a rise in teenage pregnancies across the world, and we want to have a look as to what's happening in Rwanda. We want to look at interventions on the ground by various institutions in the civil society, as well as government, and also look at the support that is there that we can start giving teenage mothers so as to socially reintegrate them back into schools and generally back into communities. And joining us, we have with us a very dear friend, a former colleague. We have with us Mireille Batamuliza, who is the Director General for Family Promotion and Child Protection at the Ministry of Gender and Family Promotion. Mireille, great to have you on The Square.
Thank you, Diana.
Great. We also have with us a regular on the show, always happy to have him here, representing not only civil society, but also the organization that works very actively when it comes to sexual reproductive health and rights. We have with us Dr. Aflodis Kagaba. Dr. Aflodis, great to have you on the show once again.
Thank you so much. Always a pleasure to be on The Square.
Great. My name is Diana Mpisi, host of The Square. As always, I'm joined by The Square's resident panelists. I'm here tonight with Berna Namata. Berna, always a pleasure to have you on set.
Thank you, Diana.
We also usually have our Square resident panelist, Charles Haba, who's not here with us tonight. I know he's somewhere celebrating his birthday. Happy birthday, Charles, to all of us, from all of us here on The Square. But I know wherever he is, he'll be following the show and giving his inputs on our social media feed. So before we kick off, just make sure you give your social media inputs using the hashtag #TheSquareRW, and we'll get to the social media feed shortly. So to kick off the conversation, I would like to thank you once again, Mireille, for coming on board, Dr. Kagaba for coming here. And we just want to look at the impact of the COVID-19 pandemic on teenage pregnancies. So if you'll allow me to read, reports show that in the past 8 months, when the COVID pandemic broke out, 424 girls under the age of 18 were impregnated in the northern province. And according to assessments conducted by activists in the country, specifically in the Kamonyi and Gasabo districts, testimonies show that there are many girls who were also impregnated during the peak of COVID-19. So I'll kick off this conversation with you, Dr. Kagaba. What do you think are some of the potential reasons? I know right now we're not working with evidence in terms of hard numbers and a direct causal link between the pandemic and a peak in increased pregnancies regarding teenage unwanted pregnancies during this period. But what do you think are some of the reasons as to how the pandemic can have contributed to teenage pregnancies during this period?
Yeah, thank you so much, Diana. Teenage pregnancies is a very big concern, and we've always had numbers that have been increasing even before the pandemic. If we look at the last DHS that was highlighting that the teenage pregnancy was around 7.3%, which also shows that there's been an increasing trend. We're yet to see the findings from the 2020. I'm sure the numbers will quite tell us how far we are. So the pandemic has made the situation worse. We've had a lot of redundancy. Young people have been out of school for almost 7 months now. Schools have closed, and that means there are a lot of disadvantages in terms of what are they doing. We all know that schools have always been safe spaces, not only in terms of the students and young people being focused on school, but also having an opportunity to access information. Now they have been at home. Not only them being at home, but also we have people who are working who have been at home. There's a lot of, we assume, the exposure, a lot of free time certainly is likely to lead to the increase in teenage pregnancy. But also when we look at how many people have lost their jobs, we have to look at issues of poverty. What does that mean if we have families that have been accessing income and supporting their children, and now they cannot? So you see that during this period of the pandemic, we have a number of young people who have been in school, who are trying to look for jobs, but also some of them who have certainly going to find themselves without anything to do, and they get, we know they are sexually active, but the pandemic has increased the risk. And I'm sure as soon as we continue to get the numbers, we are likely to see an increase in the number of teenage pregnancies across all districts. And I think we don't have numbers yet now, but that's the trend that we are seeing, looking at some of the districts that have provided numbers.
Thank you very much, Dr. Kagaba. I'll now go over to you, Mireille. I know you have a difference in opinion, but I'm looking forward to what you have to say to it. Do you think there's a direct cause, or not direct, but at least there's an element of how the pandemic has exacerbated the issue of teenage pregnancies in Rwanda?
Thank you, Diana, for this opportunity to host me in this Square show. As you said, there is no single reason that can be attributed to the increase of teenage pregnancy. It's a combination of factors. As we were saying, COVID affected countries, families, communities, and individuals. But when it comes to vulnerable groups, as children and women, it really had a negative impact. As Kagaba said, children were at home without their normal life, normal living situation, not going to school for a long period of time, and this increased their vulnerability and reinforced the imbalanced power relations that already exist. But as we said, there is a constant rise of teenage pregnancy. If you look the last 5 years, as Kagawa said, in 2017 there was an increase. From 2017 to 2018, when you see the cases that were recorded, 17 cases in 2017 and 19 cases, 382 in 2018. There was an increase around above 10%. And when you go to 2019 with 23,000 cases, there was an increase around 30%. So it's a trend of a rise in cases. And also when you consider the data of teen mothers that are going to look for services, for the antenatal services for their first time, there is also an increase in numbers if you consider that. And I would like to highlight what Deputy DG Rib said during the launch of the campaign in October. She said that there was no linkage between the COVID period, because when you consider the data that were recorded before COVID, they had 1,537 cases when you consider Jan-March data. But when you go to total lockdown, March to June, we had 864 cases. So the case reduced. And also when you consider the cases recorded June to August, there was also an increase. So when we were in total lockdown with the rise of the COVID-19, the cases tended to be reduced. So it's a multiple factors contributing to the increase of teenage pregnancy cases that can not only be attributed to COVID. Thank you.
Bernard, before we get to you and hear your opinion on this, we are waiting for fact-based numbers. I think this is something that we're going to collate and collect in terms of the institutions that are responsible for this. But ideally, the discussion right now tonight is just to understand, is there a link? And if there's an idea of how the link can be, what are some of the causes? And we've heard from Dr. Kagaba and Mireille. I would like us to just go to a social media feed and read some of the tweets that are coming in regarding the comments ahead of today's show. And we have the first tweet that's coming in. And the first tweet is from Frank Chigenza, who says that teen pregnancies and child sexual abuse are results of a terrible cultural problem. them. Remove barriers, stigma, and myths. Sex is natural, not an abomination. Proper reproductive health education will help the youth behave responsibly. That's the first tweet that we have from Frank. And before we go to the next tweet, Frank is just basically stating what we have stated multiple times on the show, and which is what we're going to discuss today. We also have a tweet from Fiona who starts that says that we need to see the picture now and the analytics, because I think it really affected the Rwandan society and specifically young girls. She also looks forward to hearing what measures are going to be taken in response to the increasing number of these teenage pregnancies. The next tweet is from Sylvie, and Sylvie Nsanga, I know, tweeted and said that, one, women face so many challenges with COVID-19 exacerbated. Teenage girls are vulnerable groups struggling with specific age-appropriate challenges ranging from peer pressure, bullying, relationships, but also lack of access to basic needs and services. Teen pregnancy is her second tweet, where she says, isn't a new thing. In fact, it is the real virus we had, still have, and COVID-19 added to its severity. We need to disrupt the management and response mechanisms to make sure they have the right knowledge and support system free of stigma. And her last tweet states that our society is failing teenagers. The majority of perpetrators are adults. Normally in our culture values, they should have been the protectors. Adding the monster called justice, which requires scientific proof. Let's make it simple for teens to access justice. We'll have more of the tweets coming on later on in the evening. Brenna, I know this is something you're also very passionate about. We've discussed it on the square a couple of times. What's your take on it regarding the first segment of the discussion, the link between the pandemic, the lockdown, not going to school, schools being safe spaces, and the teenage pregnancy trend that we've been having for the last couple of years in Rwanda?
Thank you. Of course, this is something I'm passionate about, but it's really painful. It's painful to discuss it. It's painful when you look at the numbers. It's even more painful if you look at the profile of the victims, because teenage pregnancies have a specific face. Yes, they can affect anybody, but on a broader scale, you'll find that teenage pregnancies have a specific face, which is poverty. So when it happens in a particular home, there will be, of course, resource constraints. It will just make the situation even worse. Now, as we have seen over the last couple of 6 months, COVID has been a stress test across board. What COVID has simply done is, one, expose what has been already happening. Now, I wouldn't want to go into the semantics and the numbers of before or after COVID. The fact is, it shouldn't be happening, with or without COVID. So I feel that the discussion has to focus on, why is it happening? Why does it continue to happen? Now, this week we had news around the vaccine. So many people are focused on finding what to do around COVID. I'm not sure that's the same around teenage pregnancy. You know, even when you look at the resources, even when you look at the focus, for instance, of the law enforcement agencies. Over the last couple of months, again, we've seen enforcement agencies upping up pressure, for instance, on corruption. Everybody, I think, over the last 6 months had something about corruption and these high-profile cases. And where is the outrage about teenage pregnancies? You know, so when you think about it, it's actually quite depressing. Yeah, and I wonder whether by even having this discussion, we are joining the rhetoric, you know, of talking about it and not doing what needs to be done to address the issue. For instance, we saw that over again during COVID, exposing the name and shame around COVID violations. Yes. The same pace hasn't happened with perpetrators. Yeah. And why? Why do people continue to get away with spoiling the future for our young girls? What does it take? How much money does it take to actually get these perpetrators to feel the pain? Because think about it. A teenager, 15, 19, this is just a child. We shouldn't even have the word pregnancy in one statement with a child. We shouldn't have that. But the moment we begin to talk about it and kind of give it a face like it's just happening, and people will talk about it, but we have children here whose lives are just gone, and then you'll have the courts say this man was found and maybe it's 5 years, and it just stops there. But this child's future is completely ruined. Now, on the other hand, we also have a lot of focus around teenage girls. But statistics we have seen in the past also show that there are teenage boys involved. Where are the men in this equation? Let's start from there.
Absolutely. When I'm hearing you talk, and one of the things I fear is that, I don't know, but I hope we're not getting desensitized to this issue. You see teenage pregnancies, you see the numbers have keep on growing. And as it is with things in the media or in news, you keep on seeing certain numbers and you just get desensitized, and it's life as usual. I really hope we're not getting desensitized as a society, in terms of communities, in terms of leadership, to understand that this is something that's endemic. The numbers have been steadily rising, and which brings me to the next question in terms of interventions on the ground, interventions between institutions, between governments, stakeholders, in terms of what needs to be done, or what needs to be changed. But the first question in this regard, I'll go to you, Dr. Aphrodis. What campaigns or interventions, at least most recently during this, since the outbreak of this pandemic, has your organization engaged in terms of highlighting or promoting awareness on this issue and trying to curb teenage pregnancies in Rwanda?
Yeah, as I earlier said, one of the important interventions is to ensure that everyone has access to accurate information, and which is one of the situations that COVID, the pandemic, has made worse. When young people are not accessing information, we know that those who are in school have been trying to access information through the comprehensive sexuality education program, which is part of the curriculum since 2016. They are able to have, some SRHR awareness in their subjects. It is yet to be improved again, because if you look at the current level of implementation, there's still a lot to be done. But at least that is one of the channels. For out-of-school youth, it is still quite challenging, but there are a number of organizations that are trying to reach out, trying to engage communities, interest parents to discuss with the young people, to ensure that they have access to accurate information. And one of the things we have focused on during this period is to ensure that we intensify access to accurate information through different channels. I know with COVID it has been very complicated. We couldn't go to schools, but we've been trying to diversify and innovate on how can we ensure that young people have access to information. We've been quite engaged in social media, but understanding that those who need more information are those in rural areas mainly, and they can't access social media. It's quite challenging. But at our level, we have also been trying to reach out, though complicated, but we've been trying to meet teenage mothers at community level, talking to district authorities at all levels, ensuring that people involved in service delivery are trying as much as possible to continue services. One of the other challenges that COVID has had impact on is, of course, continuity of services. If you have to go to a clinic and first have to get permission, it gets more complicated. But to ensure that as much as COVID is there, we don't forget about other essential services like sexual and reproductive health rights, ensuring that we continue to consider the services as a priority, and of course allocate resources to it. That has been one of the areas we've been focused on in terms of advocacy. We've increased our radio programming to ensure that at least people can access radio. From the data that we have, we know most of the rural communities can access radio programs, even in rural areas. Of course, coverage is still not the same in all parts of the country, but as much as we diversify different radios, at least we increase the chances of accessing information. We've been trying to innovate, and this year we started HDI TV, and it's quite interesting. One of our videos that is focusing on menstrual hygiene, it's quite interesting, has been viewed by over 100,000 people, and that shows that people are trying to struggle as much as we are in this period, but they're trying to access information. We continue, of course, to advocate. One of the other challenges we have, I think, which I hope we'll be talking about as well, is the legal framework. The current legal framework, the current policy and legal framework, and I'm happy because our country has been discussing this. We are already having conversation to say, how do we ensure that adolescents can access services without parental authorization, which is still part of in our laws. We have the Human Reproductive Health Law, which gives rights to people of majority age, leaving out the minors, and the Medical Liability Insurance Law, talking about rights of health service users, that still requires healthcare providers to ask for parental approval, basically, before they give service to a minor. And this is a challenge. So we are very much involved in continuing to discuss with different stakeholders. We've been partnering with Input, of course, in most of the community awareness. And I'm looking at May because my image of her is with Input Foundation. And happy to meet you, Mireille, from Mije Prof now, which of course now you have you in the steering position. So we do hope that these conversations around how do we review these current laws will be taking maybe, we'll be giving them more attention to ensure that at least we can look at, we understand minors and consent is a very big debate everywhere, not only in Rwanda, but how do we ensure that minors who can make their decisions can be trusted to make decisions? Maybe at what age? Should we consider 14? Remembering that our penal code or the law determining general offenses and penalties has somehow thought of minors who are 14 to 18 if they are sexually active and they're involved and there is no physical violence. So that came, of course, from the acknowledgement that young people are sexually active. And as much as we are thinking about what do we do, what solutions do we have to put in place, we have to keep in mind that there are young people who are sexually active, 17, 16, who may need to access services. And if we still require them to go through parental consent, it may be a bit difficult. I mean, let me speak here as a doctor. If a young person who is 15 or 16 had a disease, say malaria or a chronic disease, and they wanted to be accompanied by their parents, it would be very easy. But if it was a condition to do with sexuality, an STI, it's very difficult still in our setup. And when we're thinking about it, everyone who is involved, we have to also understand that if you have more access to information, you can make informed decisions. But if you don't, if you've not been given the opportunity and you're in a rural area, you're in a district where don't have enough opportunity to access information, and you need to have services, but you have to be accompanied by your parents who may be having other challenges of beliefs. Every parent doesn't want to accept. I'm a parent as well, and I think my daughter is now 6 years, but maybe when she starts asking me about relationship when she's 15, my views may be not as easy as, they may not flow as easily as they are today. But I do understand that we have to continue these conversations, and at our level, we are very much interested to continue to ensure that we consider revisions of the current legal framework, even to start to say or to consider what should be the age of consent for sex. Because some countries have looked at that as well and taken some courageous step. As much as we look at the offenders who are defiling children, I believe that if someone is already a teenage mother, there is already, if you talk to them and see the challenges they are facing, including rejection by their families, including getting out of school, including transitioning to become sex workers or domestic workers, everything stopping just because they've had that pregnancy. So sometimes you think and say, aren't we failing them? What can we do to ensure that we put every measure in place to allow different options? I still believe that there is no one best option. And when we are having this conversation, we should really look at how do we ensure that we have multiple interventions, give people different choices, and be able to accompany these young people when they are making, and as I'm concluding, sometimes we are deciding for them. Every time we want to decide, we want to feel that we know what is best for them. But we have to know, what do they want? How are they? How we were living 20 years ago, the situation has changed so much, and we need to really be ready to dialogue and be able to decide on the best choices as we move forward.
Thank you very much, Dr. Kagaba, and very well said, especially on the issue of having multiple options, multiple interventions. You know, that's not a single silver bullet, because it's a very complex issue and the repercussions are really severe in really, as Brenna said earlier on, you know, ending the lives of some of these girls or the potential that they could have. Mihai, what is Mijaprof doing? What are some of the interventions on the ground regarding this issue?
Okay. As you may recall, in October on 2012, with the First Lady of Rwanda, Her Excellency, we launched a campaign, a national campaign, and against fighting child defilement. And that day we were celebrating the International Day of Girl Child. And in that launch, the First Lady called upon institutions, parents, and every Rwandan to rethink and recommit to innovative measures to fight against child defilement that results into teenage pregnancy. And from there, we have conducted several activities in the community, and as one of the gender machinery, the Gender Monitoring Office was recently in Eastern Province in Gatsibo District, where they conducted like a whole month activities in order to celebrate Gender Accountability Day. In that activities, they were targeting teen mothers and sensitize them to go back to school. They also met with parents. As Kagawa said, if a child became pregnant, it's like double victimization, because parents chase them from home, they discriminate, the community starts stigmatizing her, she can't access services, and she's not even welcomed to her house. So they met with parents to facilitate the reconciliation and help those girls being reintegrated in the communities and for them to go back to school soon. They also met with community leaders. You know, those people are very influential, and the meeting was focusing on recalling them to support the teen mothers in their communities. We have heard several times when local leaders are involved in reconciliation of families of victims and perpetrators, and it was like recalling that action and remind them their role in the community, so they can identify those girls, they can report on time when the case of child defilement happened, so the girls can access services on time. And also they met CSOs that working in Gatsibo district to see how they can work together and provide integrated approaches and services to those girls and their families. It was also in order to strengthen the coordination, so everyone doesn't work in his corner, but they work together to deliver to the girls in the community. And you might maybe hear that RIB started accelerating investigation and towards perpetrators. You have heard what happened in Rusizi in last 2 weeks, or maybe in other activities.
Actually, I saw on Twitter, on social media, RIB is actually naming and shaming defilers, which is, I think, a good thing to kick off and start this issue of of dealing with teenage pregnancies and deferments.
Yeah, and I do agree with what Namata said. We need really to see innovative approaches to not handle issues of teenage pregnancy as we usually do, but we see what we really have to do to challenge and to halt this habit.
You know, Dr. Kagaba, earlier on, you said something very important. We look at it, I mean, overwhelming numbers of teenage pregnancies are coerced to do with violence and coercion, but there's also a significant number where they're just young people who are having sex, young boys, young girls. And the question is, you know, instead of saying, okay, these are the interventions we have, thank you for putting forward the work that HDI does, thank you for saying the interventions that, you know, from First Lady's office to Misha Prof to Gender Monitoring Office, everyone is doing something, everyone is trying to really change this trend. But this begs the question, and we've asked it a couple of times on the square, do we need to change the way we're doing things? And it's a controversial question because what we're really asking here is that when it comes to young people accessing sexual reproductive health information and access to services, do we need to change the way we provide these services? Do we need to change the mindset when it comes to what we are telling these young people who are sexually active? Because it seems that we are doing the same thing over and over again and expecting different results. This is more or less the definition of insanity. So right now, here tonight, you know, if we can be as bold as possible, what are some of the changes that we need to do when we address this issue in terms of tackling this issue from a leadership position, from people who provide this information and these services to youth? Brenna, I'd just like to kick this off with you. What, in your opinion, do you think needs to change? Because so far in the last 5 years, the numbers are growing.
Then it's a tough one. Part of the reflection I was doing before I came to this show is, one, I'm a good Catholic. And when you're Catholic, when you're growing up, one of the key messages that you're told is abstain. You know, abstain, no sex before marriage. That is what you're told as a good Catholic. That's how you're raised. Unfortunately, if you ask me today, that's quite irrelevant because young people today, as young as 15, are sexually active. And it is not about their parents. It's not about, they will find information from wherever. Yeah. So the reality has changed. And we have to deal with the reality before us. Do we close our eyes or bury our head in the sand and say, we stick to the traditional way, abstain, and we think things won't happen? Or do we choose to deal with the reality? Because increasingly, like Dr. Kagaba said, we know that young people are sexually active. And the numbers show we have teenage boys and girls involving in sex. I'm still shy to talk about it, even call it.
Call it what it is.
Yeah.
Yes.
You know, so I think we have to deal with the reality. It doesn't matter what, for instance, my personal opinion is. But what is the reality on the ground? Whether I like it or not, we have teenagers that are sexually active. And how do we help them? We have to, one, make information available. Two, we have to make services available. We shouldn't think that we are protecting children if we do not give them enough information about sex, especially safe sex. Have an open conversation about what it actually means when you have sex and what are the consequences. Because in many of our homes, it remains a taboo to talk about sex. When someone talks about sex, they are judged. Or if a child innocently raises something around sex, they are judged and their mother will, or their father will say, you're getting spoiled. That is an artificial way of looking at the reality before us. So I feel that, first of all, we need to have a fundamental change in terms of mindset. Unfortunately, most of the people behind policy, most of the people that are in charge of enforcement are the generation of abstain. So some of the things, they can't understand how someone will, will talk about a child who is 15 having sex. They will never understand it because probably in their generation it was unheard of. Yeah. But the more we engage young people and get to understand their reality, I think we will do ourselves a service if we are open-minded when addressing this issue. Let's forget about the moral side of it, forget about religion, and just look at what it means to actually, when a child is pregnant, look at what happens to their life. We don't, even as we speak, we don't have safe spaces for teenage mothers. We don't have them. So if you're saying, you want to massage the issue, provide the safe space for these teenage mothers. We don't have the safe spaces for teenage mothers. We are hearing from experts that these children are rejected by their families. Even reporting is an issue because no family wants to be identified to have a teenage mother. No parent wants to be judged that they failed to protect their child. So how do you expect these cases to be reported? So there's difficulty already. So how about we deal with prevention? Information is power. If these children at an early stage begin to understand their bodies, begin to understand what it actually means when you engage in sex, then perhaps we will open their mind about the reality. We would be very surprised in an environment where a child is not exposed to information. Ignorance is too much. They don't know. Maybe they think maybe at 15 they will not get pregnant. Because they assume it's old people who get pregnant. So I feel that we need to have a mindset shift, deal with the reality before us, don't look at it as a moral issue, and just look at it as science. Science tells us bodies, there's a certain age, when the body will behave in a certain way. So let's deal with it. Yeah.
Mireille, earlier on you said that, in 2012 when the campaign began, during International Day of the Girl in October, the First Lady said, called for innovative ways in dealing with this issue. I know you're here on behalf of the ministry. You're not here as an individual, so you'll be speaking on behalf of the ministry. But really, what are some of these innovative ways you think we should approach this issue? Brenna just said, let us be practical. These young people are having sex. We are telling them to abstain. That is not working. I don't think it's going to be the most effective method. What is your opinion on this? And I know you are someone who's been involved in sexual reproductive health and rights for many, many years. So what are some of the innovative ideas you think we can adopt?
Yeah, thank you, Diana. You're right. I'm here representing the ministry, and designing this campaign, we were thinking in that way. What should be done? Where are gaps that we can correct and emphasize in order to reduce these numbers of teen pregnancies? And we do believe that everything starts from home. Either it's a sexual education, it's a education in any way. It has to start from home. So we think parents need to be empowered, because sometimes we request a lot to those parents that have never been educated about how they can discuss those topics to their children. And we do request, and we do expect them to deliver what they don't have. So we do think we have to empower parents in order to understand the issue, and starting from the family to avail the basic information about prevention and about how to behave from early age, because the sexual education is age-based. So we do hope that if parents are equipped with those skills on how to engage with their kids, and if they have content, and if they know the ways to communicate that, it will help. Because we do believe if you empower families, you will empower all the family members. And other thing is, as you said, we have seen that these teen mothers are being supported, but the support is not really helping them because it's somehow scattered. So we were thinking, how can we provide a comprehensive and integrated package to those teen mothers regarding to their maternal health, regarding to their child development, because when we talk about ECD and when we talk about vaccine and when we talk about nutrition to reduce the risk of stunting, because there is a high risk of those babies from teen mothers to be stunted because they don't have financial means to get food and they don't even have skills to get what is really required to feed those babies. So if we can work together and provide that integrated package to those teen mothers, that one can help. And also what we were thinking is, we were talking about naming and shaming. In partnership with the ministries, they were thinking about how to launch the sex offender registry, and this is something that is under discussion to see how they can launch that registry. So everyone that has prosecuted to that crime is known and is like in the community, they know who does what. So also other thing is, as you said, the law enforcement, because when as we speak now, we want this crime, the child defilement, to be in imprescriptible crimes. So it's not like you do that, you fled the country after 5 years, you come back and you are free. No, we are discussing to make this crime, to put that crime among those imprescriptible crimes. And also we were thinking how to work with service providers and everyone on board to provide youth-friendly services, because we know some services are there, and how can we make them youth-friendly? How can we make everyone understand that it's a young person's right to get that service, because it's his right. He can benefit that service, and the service has to be a youth-friendly one.
Absolutely.
So I think those are among...
Those are, and indeed, those are actionable interventions. And I really hope in the next year we will see some tangible outcomes of some of this. The sex offenders registry, making it a crime. You know, you don't come back after a couple of years when you've more or less defiled a child. Dr. Kagaba, very quickly over to you before we go to our social media feeds. I know HDI has been deemed quite controversial in the CSO circles. What do you think needs to change? Just 2-3 pointers in terms of different approaches or different methods to really grasp and see how this issue that is endemic to our country regarding teenage girls can be stopped.
Yeah, thank you so much, Diana. Empowerment of young girls and boys. We have done some work around this, and we still have a lot of work to do. We know that it's a very big step to have CSE in the curriculum, comprehensive sexuality education. And I like what Mireille says, that it has to start from families, from homes. But parents are not ready. They don't even have skills. They're not comfortable. They have socialized in the same system where you don't talk about sex. Some people want to talk about sex in the dark, but when it comes to having an open conversation, even for adults, it is still a very complicated issue. I remember when we were at the university, people would tell you that it's not easy to talk about it. It just happens. So young girls have to be empowered, and boys have to be empowered to negotiate. Yeah, young girls have to be empowered to say no. If you're ready to have sex, be prepared for safe sex. Look for a condom. know about emergency contraceptives. We've been discussing about the cost of emergency contraceptives. Very expensive. Some people have been taking advantage of these commodities because no one wants to regulate. There's no way a commodity like Norevo, which should be, which comes in other countries at $1, is on the market at $10 in Rwanda, even more. So we need to have this regulated, because I believe that we do make decisions every day. But if you knew about emergency contraception, you'd be able to say, okay, now this has happened, but I don't need to get pregnant, and you access it, but you have no information. So I still believe that we have to intensify information, ensure good monitoring of the CSE. As I talk about this, I know it's very good to have in the curriculum, but 60% of public schools, they're in the hands of the church, which we talk on about abstinence. And we know as much as abstinence is one of the best options, is not effective alone. We need to look at other options, including being able to access contraceptives, make sure they're accessible, being able to access contraception, ensuring that if one makes a choice of having access to contraception, they can go to a place and get services without being judged. Most of the healthcare providers, service providers, have been trained in the same system. There's a lot of judgment that young people don't feel comfortable to go to a health facility. We've had discussions. We now have youth corners in health centers. We have youth centers. But youth corners are not just names. We need to go in the youth corner. What's there? What is offering? And I think Mireille has touched on it, to ensure that the youth corner is a friendly space for young people. Young people can come in without feeling being judged. They can be supported to access services and to make informed decisions. And the legal framework. Certainly we know, as much as we still need adolescents to ask for permission to use a condom, to go to a healthcare provider, this is a necessary barrier. And I'm happy because conversations are taking place. We do hope that this has to change. We need to see everyone participating. Media has been a very key, and is still a key player to even have this conversation. And I think, thank you, Diana, for organizing this kind of talks, because the media should lead in having these conversations. No one in such situations has one solution for everything. But the moment we keep discussing, and I'm happy because even recognizing that teenage pregnancy is an issue, in some countries people haven't recognized it. The fact that we are discussing it, the fact that we are concerned that it is increasing. When we talk about 17,000, 19,000 young girls, this means young girls who have been disempowered. Our society sometimes leaves them. We've been having conversations with fathers. Now, when it comes to home, there are a lot of fathers, there are a lot of men. Most of the people who stigmatize these young girls are fathers. They ask them to leave home. Some of them are forced to go and look for their partners who made them pregnant. So getting pregnant means you're married. So we need to destigmatize teenage mothers. When you say that a teenage mother has no agachiro, they have lost agachiro, I think that kind of language needs to change. They have to feel, yes, you're a teenage mother, you still have your agachiro, you're still a human being, you're still a young woman, a beautiful young woman, and life can go on. We have to ensure. I was happy with the reaction of Minister of Education on this practice of testing young girls before they go back to school. It has been going on, and we've been seeing it. But the way they responded was really very effective. Why should we test young girls to know if they are pregnant? We need also to know that boys are victims. We need to educate boys. They need to have information. They have to know contraception. They have to know how to know the menstrual cycle. We can't leave it for women. Boys are responsible for every teenage pregnancy. Every pregnancy, there is a male who is responsible for that. How do we ensure that they assume their responsibility? As we have DNA testing capacity increase, people need to assume responsibility. You can't just be there, you have a child and you never take responsibility. That needs to stop. We need to ensure that DNA testing is available, and I'm very sure it is already coming, and people have to be aware so that people can assume their responsibility. The moment you have a child, you have a human being who never made a choice to be there, you have to know that you have to be responsible to ensure that they are off the streets, to ensure that you are paying school fees, to ensure that they grow up to become responsible citizens. And I think I love shaming and shaming people who are responsible and who have not taken responsibility. So there is a lot that we need to put in effort, and I think we are on the right track. We just need to take a step and push a little further to ensure that this becomes a reality. And if we do it, some countries that have taken this kind of progressive steps, they have been able to curb teenage pregnancy. Young girls can stay in school. You can have a child when you want. We should know that as we're talking about teenage pregnancy, for Rwanda, if you look at the statistics in general, 48% of all pregnancies in Rwanda are undesired. So people have sex and they get pregnant. You can make a decision when to get pregnant or not. And I believe this has to be us ensuring that information is available for both boys and girls. When you talk to teenage mothers, we've been discussing with them why they don't report. They tell you, if we report, we stop being supported. The men will run away from us, and we need their small support. And people are taking advantage of that. So empowering, economic empowerment, ensuring that girls have other opportunities. Those who have been teenage mothers, being reintegrated, being given skills so they can go back to school. That will give them the courage to report those who are responsible, but also to ensure that teenage pregnancy does not mean failing, does not mean you become a sex worker, does not mean you become a domestic worker.
Thank you very much, Dr. Kagaba. And I really like that stance in terms of, when you're talking about support to teenage mothers, the public stance the Ministry of Education took and totally saying that practice needs to be stopped of testing young girls before they go to school for pregnancy. So I just want to read tweets very quickly on our Twitter feed. And we have the first coming from Jackson, who says that COVID-19 impacted teenage mothers more than others, if I'm not wrong. I hope special measures and special treatment should be put in place to take care of teenage mothers specifically related to COVID-19 response. The next tweet we have coming in is from Birinjiro. Birinjiro states that thanks so much for the show. I can say the biggest cause of the escalating of teenage pregnancies during this time of the COVID-19 pandemic is the fact that the teens do not have a lot to do. You know what they say, idleness is the beginning of all vices. So he's saying that, and I'm glad that, Rwanda has opened up the back to school during this pandemic. And then we have something from Edward saying there's so much awareness needed for teenage pregnancies to ensure girls have the right information and to know what to do in case they fall victims. The last tweet is from Maureen, and Maureen states that COVID-19 made matters worse for an issue that was already existing. The question begs, why are interventions unsuccessful in ending teenage pregnancies, and what can be done differently? We need approaches that can be reinforced to effectively deal with the rise in teenage pregnancies. And Maureen is echoing the gist of what we are talking about tonight. And the gist of what we are talking about tonight is a difference in mindset, a difference in the business that we engage in dealing with teenage pregnancies. We have 1 minute to the end of the show, and very quickly, I would like you to just give concluding remarks, less than a minute to end the show. What is your take on this topic for tonight, in conclusion? Mireille, very quickly.
Okay, I do support that we have to think innovative measures that support teen mothers, and we also have to think where gaps, so we can cover those gaps, and also to work mostly on prevention, because we can prevent that. We can make everyone accountable, and we can reinforce laws to punish those perpetrators, because they are ruining our country.
Absolutely. Thank you very much. Unfortunately, Dr. Kagaba, we don't have enough time for your conclusive remarks, but I think you have really expressed everything very eloquently and very effectively in a nutshell. So I'd just like to thank you once again for coming on the show as a regular panelist, a regular guest when it comes to issues of sexual reproductive health. Thank you very much, Dr. Kagaba.
Thank you so much, Darren.
I'd like to thank you once again, Mireille, for coming on behalf of Mijeprof. We're very pleased to have Mijeprof on the show. We've had them before. It's always great to have the ministry involved in this sort of conversations. Berna, great to have you as always. Looking great in Uzi, made in Rwanda. I'd like to thank our partners, Uzi Collections and Bourbon Coffee, for supporting The Square all the time. Have a good night. Keep the conversation going using #TheSquareRW. See you again next week. Have a good night. Bye.